What injustices do you see? What inequities do you see? And what or who are you waiting for to take control of that situation? Are you waiting for a leader? Are you waiting for a change agent? Someone who is brave and courageous? In the words of Mark Duplass, the cavalry is not coming. We have to be the leaders and the change that we want to see. And the cost of not stepping into that calling is far too great. Imagine, if you will, a 16-year-old girl. She is the apple of her family's eye. Straight A student, star athlete. She's already got scholarships pouring in. The family is so excited because they know that the fetters of poverty are going to be broken just because her access through education. And she's 9 months pregnant. She's hidden this pregnancy for the past 9 months from everybody. Baggy clothes and locked bathroom doors. She is very cautious about how she moves through the world for fear that her secret will be unmasked. Her mother finds her giving delivery on the bathroom floor. Mom is clearly shocked and appalled. How could she have missed that? Mom now feels that the cycle is going to continue. But did we see her? This young lady, did we hear her? Because she came into our clinic doors. She came into your emergency room. She walked the halls of your school. She went to your church. She sat across from you at the dining room table in your own home. But we did not create a space for her to be heard. We did not create a safe space for her to share. It is very easy for us to point the finger at the victim when a public health crisis occurs. Woe to you, you teen parent. You are now dealing with the consequences of your actions. But what role have we played in perpetuating that inequity? What role have we played in perpetuating that injustice? When I started as a community pediatrician after training, it was so astonishing to me that a young person could come into our health center and divulge that they were sexually active. That takes bravery, that takes courage. And if a young lady expressed that she was interested in being started on birth control, her access to the medication, which was steps away, locked behind a medication door, depended upon whether or not she was insured, and also depended upon whether or not she had the right type of insurance. So if she didn't have insurance, or not the right type of insurance, I would have to write her a prescription, discharge her from the clinic to go to the pharmacy and navigate this very challenging world of healthcare. It's difficult for me to do as an adult. Just imagine a 16-year-old trying to take a prescription, go to the pharmacy, do I need an insurance card? Will my parent find out? It can be very challenging. We didn't have anything in place to close the loop on that communication. There was no follow-up for her. And oftentimes, they didn't come back. They would go to the emergency department or come into clinic, and what would happen? Their pregnancy test was now positive. Something that we could have prevented, we clearly dropped the ball. What role did we play? That was the spark that started and ignited my passion around reproductive health. And specifically reproductive health access for brown girls who are oftentimes disproportionately impacted because they don't have access to what it is that they need. What role have we played? When I applied to the fellowship, I was concerned that my passion for reproductive health and reproductive justice, it wouldn't be enough. Maybe it was just too taboo to get me into the fellowship. I was very surprised, happy, and blessed, and still feel blessed to be a part. The other thing I thought is that it would somehow expose me to a bit more health policy. But what I gained from this fellowship was such a blessing, is such a blessing. Training in the US healthcare system, you have training for no less than 7 years, and it exposes you to a system, a structure that provides you with the knowledge, skills, and attitudes to hopefully be able to confidently impact the health on a one-to-one basis, one provider to one patient. But we know that engaging with the healthcare system is just a very small portion of what really controls and influences health outcomes. What's your zip code? Do you live in a food desert? Where do you work? How much education do you have? What's your income? Do you feel safe going outside of your home in the morning or in the evening? Do you live in a walkable community? All of these things together have a far greater impact than just engaging with one patient one-to-one. And the health policy and health equity coursework that we did over the past year was very helpful in helping me to truly understand that. The other thing that medical training does in the US is it exposes you to this very hierarchical, paternalistic method of leadership, right? You've got somebody at the top or a group of people at the top. They all look the same. I'll let you use your imagination about that. You've got people in middle management, and then you've got people at the bottom, right? And you are required to respect and honor this structure. And there's a place for that. If I'm in the trauma bay in the emergency room and there's a trauma stat, I've got to know who's in charge, what's my role. I have to listen to what they want me to do and act accordingly because somebody's life is at stake. But on the other end of the spectrum, when we're talking about health equality, communities, lives of folks in those communities are at stake. And they too need leadership, but a different type of leadership. One of the things that I walked away with from this fellowship and started to get me thinking about is really leaning into my discomfort around adjusting the way that I viewed leadership. It's 15 or 20 years in the medical system in training, learning one way of doing something, right? But there is a finesse to leading in health equity. I have to show up to the work and ask, who are my people? And not just who are the bodies that are going to do the work and check the boxes, right? But who are my people? Where do they come from? What are their lived experiences? What is it that intrinsically motivates them to come to the work? I have to distribute leadership. My reach can be so far greater if I help to encourage people to tap into their own innate ability and passions to do leading right alongside me. I have to leverage the stories of the people that I am not just fighting for, but hopefully fighting with. I've got to scoot my chair over and allow those people to have a place at the table, sharing their stories, which also helps to move the work right alongside the evidence and the data. It is no less important. I have to have them at the table, not just at the end when we're talking about how well did this work, but we've got to have them at the table when we start the conversation up. Not just the planning phase, but the pre-planning phase. They've got to be present all along the way. Another thing that this program helped me to do, which was very uncomfortable, is hold a mirror up to myself and say, how am I showing up to the work? Am I showing up providing a toxicity to the environment? Or am I showing up with affirmation and encouragement and inspiration for the people that are working right alongside me? It also provided a set of practical steps that have been very, very helpful. We have to be mindful of the snares of perfection, the snares of over-preparation, right? We could have another meeting, another planning call, we can have another learning session, another training, but at some point we've got to move out of that cycle of planning and put our hands to the plow to do the work. There is a place for planning, and it must be done in order for the work to be done effectively, but you can't get caught up in this cycle of perfectionism. The other thing that I thought was so very profound is leaning in and celebrating my failures as much as I celebrate my successes, right? I could write 10 grant applications, 9 of them might be declined, and I might get funding from 1. That is a success. I might try to engage with 10 different foundations. 9 of them might turn me away, but I might actually get an endowment from another. I could write 10 manuscripts. 9 turned down, 1 gets published. I have to take that experience and continue to move the work forward, learning from my failures and leaning into that, because that also helps to move the work forward. When I started the fellowship, I was in a position of co-leadership for a program called Healthy Generations. It's been around for quite some time, and what we do through that program is provide comprehensive care in the primary care setting to adolescent parents and their children. And the program was undergoing such change and was in a position of challenge. It's primarily grant funded, and some of our grant money was drying up. The social workers who are the crux of the program felt a bit uneasy, and we had a mass exodus of all of our social workers. It was meeting with the fellows every other week, albeit virtual, learning from our professors about different aspects of health policy, health equity and leadership that helped to push me along. There were practical things that I gained and applied almost immediately. And I must tell you that today we are fully staffed, all of our social work positions, and we've actually secured an endowment that will help us to move the work forward far beyond when I am gone, which is great. 2 months prior to coming here, an opportunity crossed my desk for another leadership role. Associate Medical Director of a community pediatric health center that is on this amazing campus where they have numerous organizations. So they have a middle school and an elementary school, they have a community garden, there's fine arts, there's performing arts, a place for homeless youth, mentorship programs, and they needed someone to come in and help to support the work around the medical care that's being delivered out of this health center. And a year ago, I probably would have, through self-negative talk, just deleted it, right? I'm not qualified for that role. But through this fellowship, I actually leaned into that discomfort and said, why not me? Why not me? So I ask again, what injustices do you see? What inequalities do you see? Who are you waiting for? Are you waiting for a leader? Are you waiting for a change agent? Are you waiting for someone who's brave and courageous to take on that role? Help is not coming. We are the change that this world needs right now. Thank you.